I'd be happy to. So this really is a culmination, and I think of this as a constant evolution. So we are just at the beginning of being able to take what we've seen over the last couple of decades to be able to bring this together in a form, in a packageable form, so to speak, to really train people in how their minds work. And I think of this as kind of a three-step process. The first step for anybody being able to work with any type of habitual behavior or addiction is to be able to recognize the pattern that they're stuck in. I think anybody that's struggled with addiction or any habit can relate to this. You know, if we don't know that we're stuck, if we don't know that we're on autopilot, we can't step out of those habit loops. So the first step in this Mindshift mindset is to be able to recognize whatever habit loop we're stuck in. Typical habit loops have three key elements: a cue, a behavior, and a result. But we can actually even simplify that to really focus in on the behavior. What behavior is it that I'm stuck in? You know, and typically if we think of an addiction, you know, is it smoking a cigarette? Is it reaching for that, you know, for the alcohol? Is it reaching for another substance? Or could it even be a behavioral addiction? You know, am I reaching for my cell phone? The definition that I learned in residency of addiction is continued use despite adverse consequences. And I really like that definition because it really extends beyond the classic addictions that we think of, whether it's alcohol, cocaine, opioids, you know, whatever. It really extends to anything that, you know, where we're continuing to use it despite adverse consequences. And so here in this first step of this mind shift mindset, we can start to recognize what is the behavior that I'm continuing to do despite adverse consequences. So once we recognize that behavior and can see it clearly, and sometimes it's pretty obvious, and sometimes we're you know, we might not be thinking that it's as problematic as it actually is until, you know, somebody might point it out to us, or we look in the mirror or whatever it is that says, hey, wait a minute, maybe there are some adverse consequences that I'm ignoring or I'm not paying attention to. Once we recognize that behavior, we can then step into the second step of the Mindshift mindset, which is to ask a simple question. And the simple question is, what am I getting from this? And what I mean by this is that our brains are set up to continue doing behaviors that are rewarding and to also stop doing behaviors that are not rewarding. And what the neuroscience suggests here is that this has nothing to do with willpower. You know, we often think, oh, I just need more willpower to, or I just need to, you know, grit my teeth and, you know, and plow through this. But in fact, that's not how our brains work. Our brains are going to keep doing behaviors that they find rewarding. And so the only way to really step out of these habit loops is to ask ourselves, not intellectually, but really feel into our direct experience and look at the direct consequences of our behaviors to see what the results are. And so here with these habit loops, we can take that behavior and we can look at the result as well and ask, what am I getting from this? We can feel into our direct experience where we can see, you know, if we smoke cigarettes, for example, and we smoke a cigarette, that just keeps that the nicotine dependence going, so that when the nicotine gets out of our system, we have that craving for another cigarette, we smoke another cigarette, so that it keeps us stuck in that cycle. And so we can see, well, when I smoke a cigarette, I'm actually reinforcing this habit loop. We can see, you know, if we are anxious and that triggers us to drink alcohol. I see this a lot in a lot of my patients where, you know, that alcohol gives them that temporary, you know, I describe this as the brief relief because they're avoiding that anxiety for a little bit. You know, they might be numbing themselves or becoming a little bit intoxicated, but that doesn't last very long. And that actually feeds back and drives that habit loop that says, hey, next time you feel anxious, have another drink and do it again and again. So if we can step back and really ask ourselves, well, what am I getting from this? We can see, oh, well, this, whatever this behavior is, may not actually be leading me to a happier and healthier life. It might just be keeping me stuck in a cycle. And it might be keeping this, this reinforcement learning going. And it also might be not feel very good when I have that next craving. I've never had a patient that says, yeah, cravings feel great. No, they're not supposed to feel good. They're there to drive us to do something. And they say, go get that thing that makes you feel better. Go scratch that itch. So here in the second step, we can step back and ask, what am I getting from this? And we can look at all of the results that come from the behavior. And we can start to see if there are adverse consequences. We can start to see those very, very clearly. For anybody that has experience with motivational interviewing, they might have asked themselves, or somebody might have asked them the question, well, why don't you do X more? Which actually gets us to really explore, well, why don't I do this more? Why don't I smoke more cigarettes? Why don't I drink more alcohol? Why don't I use opioids more? This can help us step back and look at those direct results so that we can see, oh, maybe there are some adverse consequences here. Maybe it doesn't feel very good when I have that hangover. Maybe it doesn't feel very good when I'm stuck in this cycle of needing that next cigarette. And that can really help us start to become disenchanted with the behavior. That's what the second step is all about. It really taps into the strength of our brains and taps into this reinforcement learning process to help us become disenchanted with the behaviors. Once we start to establish this second step, and it's not like it happens overnight or is magical, this often is a tough look for a lot of folks, where they have to look at all these consequences and see them very, very clearly before they start to become disenchanted. Once we can start to become disenchanted with that old behavior, we can step to the third and final step, which I think of as finding these bigger, better offers. And what I mean by that is that we can, if our brains are constantly looking for, things that are rewarding, we can start to compare, well, what's it feel like when I have a craving to what's it feel like when I get curious about that craving? And this is where the Mindshift mindset comes in, where we can really train and foster our curiosity. Curiosity itself feels better than craving. My lab's done a fair number of studies on this. Others have done studies on this as well. We can look at our own experience and see that for ourselves. Craving is there. It's not supposed to feel very good. Curiosity, when we're really curious, oh, what does a craving feel like? That can help us actually open to our experience and be with unpleasant experience itself. And curiosity itself feels pretty good. I'll give a concrete example. I remember a patient when I was working at the VA hospital who came in and he said, hey, doc, I feel like my head's going to explode if I don't smoke. And so we actually brought some curiosity right to that moment. And I said, okay, well, what does head exploding feel like? And we walked through and had him get curious about what his physical sensations, what his thoughts were, what his emotions were as he was having this craving. And what he noticed was this craving, it was going up as we were sitting there, exploring it, going up and up and up. And then it crested and it started to go back down. And he had a big epiphany at that moment. He realized, previously he had always smoked a cigarette to make that craving go away. But he learned, oh, this craving is just made up of physical sensations. And I can actually be with these when I'm curious. And with that curiosity, he could also see that this craving would come and go on its own without him having to smoke a cigarette. So this empowered him quite a bit to see that he didn't have to smoke cigarettes. His head wasn't going to explode. And that curiosity was like a superpower for him, that when he had cravings, he could bring that curiosity to those cravings. And instead of, feeding the cycle by smoking another cigarette, he could actually step out of the cycle by bringing that curiosity in. So I think of finding, I think of this third step as finding what I call BBOs, the bigger, better offers. Curiosity is that bigger, better offer compared to, succumbing to a craving. Another thing that I see quite a bit is that people judge themselves. They feel like they failed themselves. They've failed their family and friends. They've failed their communities when they don't feel like they have control over whatever their addiction is. Well, again, willpower is more myth than muscle. And so here we can even explore, what does self-judgment feel like compared to bringing kindness to ourselves? It's like, oh no, I'm a terrible person. What does that feel like compared to, oh, well, I've been stuck in this cycle where my brain has been addicted for a bit. I've been told that I'm supposed to use willpower. I haven't been able to do that. And maybe that's not my fault. Maybe I just haven't learned how my brain works. So really the key to this Mindshift mindset is learning how our brains work, learning how to work with our brains, and then even learning how to put our brains to work for us. And so in this 3-step process, whether it's cigarettes, whether it's cocaine, whether it's alcohol, whether it's cell phones, whatever the habit loop is, we can bring this awareness in, we can learn how our brains work, and we can all learn how to work with our brains instead of fighting against them and then blaming ourselves for failing because we haven't had enough willpower. So that's really the simple, it's simple. It's not necessarily easy, but it's also not some huge, tome of material or concepts that we need to learn. This is really about bringing a couple of simple things in that we all already have. One is awareness. We've got to be aware of the habit loop. We've got to be aware of the results of the behaviors. And then we can bring that awareness in itself, that curiosity in, and have that be that superpower that helps us step out of these old habit loops. That awareness is key to any behavior change. And notice how it has nothing to do with willpower. So that's really the key ingredient to this Mindshift mindset. And we can go into this next piece now. We're really excited to start, bringing some tools out to the addiction community to help people be able to learn to work with their minds, and also, importantly, to have community to help support them along the way.